Good morning, good afternoon, everyone. Thank you so much for giving me this opportunity to present at this 8th conference on liver disease in Africa. My name is Lubinda Chingumbe from the Center for Public Health Promotion in Southern Africa, particularly Zambia. I'm presenting on leveraging HIV prevention platforms to integrate hepatitis B and C screening among key populations in Zambia. This is an insight from the Latu Human Rights Foundation and the Center for Public Health Promotion. I do not have any conflict of interest in this study, but just to highlight that this is an insight and experience from clients, Human Rights Foundation, Center for Public Health Promotion, and the Ministry of Health in Zambia. Key populations, as we are aware, all of us in sub-Saharan Africa are disproportionately affected by HIV and viral hepatitis B and C. Yet public health programs often operate in silos, and recognizing this gap, the three organizations thought to integrate hepatitis B and C model into the screening of the existing prevention platforms for HIV targeting key populations. And these included female sex workers, included men sex with men, transgender individuals, and people who inject drugs across Zambia in 5 districts from Lusaka, Kabwe, Kapiri, and to Nakonde. The methodology that which we used from October 2023 and into March 2025, hepatitis B and C screening using a rapid diagnostic test was incorporated into the routine delivery of clients that were seeking HIV prevention services at key population wellness centers in the 5 districts. So the clients were screened whilst they were being offered PrEP, and they were being assessed and the initiation during the initiation sessions and the eligibility sessions. Data was collected on PrEP eligibility, PrEP initiation, hepatitis B and C status, risk behaviors, and also referral outcomes. So the results, a total of 4,823 clients were screened, 93% were found eligible for PrEP, and 81% were initiated on either oral or long-acting injectable PrEP. Just to highlight that Zambia is one of the first countries to implement injectable long-acting PrEP outside the study setting. So we had a good number of clients that did wanted to go on the injectable PrEP. But here, just the results are showing 91.7% were negative, and 6.2 had the hepatitis B, while 2.1 had the hepatitis C. And also just to mention that the clients who were positive here were also on PrEP, and primarily those reporting a group in sex, transactional sex, and also injectable drug use. Here we referred the clients for confirmatory testing for further management into public health facilities that are under the Ministry of Health, and 78% of them were positive cases. But we just want to highlight that here providers also reported high client acceptability and operationally in the integration of this model. So here, as you can see, 288 were on PrEP, and then 113 were not on PrEP, representing 28%. The PrEP cascade among the key populations, and that's the number that we screened, and the eligible ones were 4,485, and we initiated on PrEP 3,633. What is our conclusion in this context? So we, as a consortium organizations, we are saying HIV prevention platforms, especially those that are delivering PrEP, present an effective entry point for hepatitis screening and linkage to care for key populations. As you are aware, hepatitis B and C, these are viral diseases that have been left out in the prevention cascade. And so we wanted to demonstrate that this can work one to line as an integration or parallel as we we provide the screening. So this also improved the screening coverage. It has reduced the stigma, and also, leveraging on these existing infrastructure and client trust, because, KPs deserve the trust that they need from the healthcare providers. And this pilot has demonstrated that it's possible to do a scalable model for holistic infectious disease prevention in limited resource settings like we have in Africa. We are aware of the funding gaps that we have at the moment. So we are calling for integration of these particular models and prevention cascades to ensure that we leave no one behind. So we strengthen these referral systems and also ensuring that access to hepatitis treatment becomes a critical step to sustain health outcomes. Allow me to recognize my co-authors from the Ministry of Health and also from the Astram consultants, including Latu Human Rights Foundation and the Center for Public Health Promotion. Thank you.